Welcome everyone to a new video. Today we will discuss postpartum bleeding. Besides, we will discuss causes, duration and risk factors of excess bleeding and what to do after a short introduction. Bleeding after delivery is known as postpartum bleeding. From 4 to 6 weeks, postpartum bleeding is normal. Anything more and heavy bleeding with pain and other symptoms are known as postpartum hemorrhage. How long does postpartum bleeding last? Causes of bleeding. Difference between bleeding in C-section and vaginal birth. When to call the doctor? Want to know all the answers? So, let's get started. How long does postpartum bleeding last? Postpartum bleeding is started right after delivery. During normal birth, you may bleed about 500 ml. But in C-section, you may bleed almost 1000 ml. So, you may need to give extra blood to prevent anemia due to excess blood loss. Often women get severe illness due to blood loss. So, always check for excess bleeding. From birth to 24 hours, you may bleed heavily and require 3 to 4 pads every 2 hours. After 24 hours from 3 to 4 days, bleeding reduces to some extent. After 1 week to 2 weeks, you may bleed lightly and require 3 to 4 pads every day. After 2 weeks to 4 weeks, you may bleed very light with some small clot with 2 pads daily. After 4 weeks or 1 month, you may bleed very little. Some days not shown any bleed. You hardly may need 1 pad daily. After 40 to 45 days, you may notice no bleeding. This is the normal procedure of bleeding after delivery. Causes of postpartum bleeding. It is the normal procedure after delivery. The blood is known as lochia and may smell different from your period blood. When you give birth, the placenta is also delivered. After placenta delivery, the uterus contracts and the area of the blood vessels clear lochia. If the contraction does not happen correctly, postpartum hemorrhage may occur. When should you call a doctor? Postpartum hemorrhage is a cause for concern after delivery. When bleeding lasts more than 2 months, then you should call your doctor. Besides, if bleeding is heavy for more than 36 hours with very large clot and foul smells, then it is a cause for concern. If you feel severe cramp like pain, dizziness, lack of energy, then you should call a doctor. Postpartum bleeding is normal bleeding known as lochia to complete the birth process. However, postpartum hemorrhage is a very serious cause of concern. You may be going into sudden shock and death for extreme blood loss. So, if you notice anything abnormal, call your doctor or report to your nurse. If you have any question regarding this topic, kindly comment below. Thanks for watching the video. Please subscribe to our channel. Do not forget to hit the like button. If you like this video, kindly share it with your friends. See you in the next video.